Hi, my name is Sunil Mehta, and I am the local medical director for Gray and Bruce EMS services with SWORB. Thank you for the dedication you show in your work every day. Our communities are healthier and safer because of your efforts. Your role in the healthcare system cannot be understated. From 911 calls to community paramedicine and even palliative care, our population in Southwest Ontario benefits from your expert service. I hope each and every one of you has a happy and safe Paramedic Services Week. As part of our observance for the week, SWORB is once again answering Ask MAC questions in real time.
Why do all inferior STEMIs need a fee for R? Which changes in the inferior leads would prevent me from being able to use nitroglycerin to treat chest pain? If I observe T wave inversion or ST depression in the inferior leads, am I able to use nitroglycerin?
So the diagnosis at play here is right ventricular myocardial infarction, and that's the potential diagnosis which warrants you obtaining V4R and also results in a contraindication to nitroglycerin use. So when you look at your 12-lead ECG, the inferior leads 2, 3, and AVF correspond to the inferior portion of the heart. And while that is predominantly the left ventricle, the blood supply to that area also supplies part of the right ventricle. In fact, 30 to 50% of all inferior MIs have some right ventricular involvement. So when you see an inferior STEMI, you obtain V4R to diagnose right ventricular myocardial infarction. And specifically, you're looking for ST elevation of greater than or equal to 1 millimeter in V4R. Importantly, you do not need to obtain V4R unless you have inferior ST elevation. That is the only circumstance in which nitroglycerin is explicitly contraindicated. Other scenarios, such as T-wave inversions or SD depressions, do not result in a blanket contraindication to nitroglycerin, and acquiring V4R will take a valuable time without resulting in any change in management. So why is nitroglycerin contraindicated in right ventricular myocardial infarction? Well, to understand why, you have to understand the concept of preload as it relates to the right ventricle. In that context, preload refers to the return of blood flow into the right ventricle and how it fills in diastole. Essentially, you're looking at a circuit. You have blood flow into the right ventricle, which needs to push blood through the pulmonary circulature, and into the left ventricle, which needs to fill enough that it can push blood into the rest of the heart and maintain your blood pressure. In the setting of right ventricular myocardial infarction, your ability for the right ventricle to squeeze is impaired. It can't push as much of that blood out into the left ventricle. As a result, the left ventricle can have decreased ability to maintain blood pressure. When you give nitroglycerin, you are giving a vasodilator. In effect, what happens is you get decreased return of blood into the right ventricle, or reduced preload. When that happens, you now have an impaired right ventricle that has less blood to work with, resulting in less forward flow of blood, less blood filling the left ventricle, and lower blood pressure as a result. So ultimately, giving nitroglycerin in right ventricular myocardial infarction can cause profound hypotension and hemodynamic instability. And that's the reason why nitroglycerin is contraindicated in right ventricular myocardial infarction. So the only time, as a reminder, the only time you need to get V4R is if you have inferior ST elevation. And if you see it, you don't give nitroglycerin, specifically because it can cause profound hypotension and hemodynamic instability.